Hello guys, and today we're gonna talk about acute leukemia. Well, acute leukemias are very serious blood disease known as malignant hematological disorders. They are characterized by an abnormal and rapid proliferation of immature cells called blasts. And these blasts are proliferating in the bone marrow. These blasts originate from a mononuclear multiplication, meaning they all come from a single abnormal cell that has started dividing uncontrollably. Normally, hematopoietic cells, which give rise to red blood cells, white blood cells, and platelets, mature progressively through several stages. But in acute leukemias, this maturation process is blocked very early, preventing the blasts from becoming functional cells. This accumulation of immature cells in the bone marrow blocks the normal production of blood cells, which can lead to anemia, repeated infections, and bleeding. That's why this disease is considered potentially very serious, with often a grim prognosis if not treated quickly. The diagnosis is guided by a complete blood count, or what we call CBC, and a blood smear, which allows the detection of blasts in the blood. It is then confirmed by a bone marrow aspiration, called myelogram, procedure that involves collecting a bone marrow sample to be analyzed under a microscope. There are mainly two major types of acute leukemia, depending on the origin of the affected cells. First one, acute myeloid leukemia, AML. It affects the myeloid lineage, which produces red blood cells, platelets, and certain white blood cells. This type mainly affects adults. And the second type, acute lymphoblastic leukemia, or ALL. It involves the lymphoid lineage, responsible for the production of lymphocytes, and it is more common in children. Well, when it comes to pathophysiology of acute leukemias, I try my best to make it as simple as possible. The onset of acute leukemia can be promoted by several risk factors, although in the majority of cases, no specific cause is identified. Among the known contributing factors, we find certain cancer treatments, particularly chemotherapy, exposure to radiation, such as those used in radiotherapy or during nuclear accidents, and toxic substances like benzene. Genetic abnormalities are also a contributing factors, which may be inherited or acquired during life, as well as certain pre-existent bone marrow disease, such as myelodysplastic syndrome, which can evolve into leukemia. In all cases, what characterizes the disease from a pathophysiological point of view is the massive proliferation of abnormal blast cells, as we said before. This uncontrolled multiplication leads to two major consequences. First one, infiltration of the bone marrow. The blasts progressively replace normal cells, thus preventing the marrow from properly producing essential blood cells, red blood cells, white blood cells, and platelets. This causes bone marrow failure syndrome, responsible for anemia, frequent infections, and coagulation disorder. Secondly, the circulation of blasts in the bloodstream. Once in the blood, these cells or blasts can invade other tissues or peripheral organs, such as the lymph nodes, liver, spleen, or even the central nervous system, which causes what we call a tumor syndrome. What is the progression and the prognosis of acute leukemia? Without treatment, the natural progression of acute leukemias is generally fatal within a few weeks or months, unfortunately. The rapid and massive proliferation of blasts combined with the cessation of normal blood cell production leads to serious complications, like we said before, infections, hemorrhagia, or multi-organ failure. However, the prognosis varies depending on the type of leukemia. In general, ALL or acute lymphoblastic leukemias have a better prognosis than AML or acute myeloid leukemia, especially in children, in whom remission rates are higher thanks to current treatments. Where there are several poor prognostic factors that have been identified, and their presence may make the treatment more difficult or reduce the chances of recovery. These factors may include age over 60 years or under 1 year, likely due to lower tolerance to treatment or a more aggressive form of the disease, the presence of a significant tumor syndrome or meningeal involvement, indicating widespread dissemination of the disease, marked hyperleukocytosis greater than 15,000 at diagnosis, which reflects particularly intense proliferation, and favorable cytogenetic abnormalities, meaning genetic changes in leukemic cells identified through a specialized test in which influence the response to treatment. Finally, a lack of therapeutic response after 1 month of induction treatment is also a sign of poor prognosis, indicating resistance of the disease to initial chemotherapy. We will talk about clinical symptoms and treatment for this pathology, and if you have any questions or any suggestion, no matter what, you can just write it below in the comments. I hope these videos are helpful to you, and if you find my videos helpful, please consider liking and subscribing, because that makes me so much happy, and when I am happy I make more videos. Thank you so much for watching till the end, and I'll see you in the next one. Bye bye.